So in this video, I'm going to be talking with you about what you can expect during your first semester of nursing school. So whether you are about to get into nursing school, you're thinking about going into nursing school, or you're in it right now and you're not sure what to expect, you're going to find this video helpful. Make sure you stay tuned and watch this video to the very end. So I'm going to be talking with you about 6 different things that you can expect while you're in nursing school. Now this, I would tell you, if I had learned this information ahead of time when I was in nursing school, it would have given me some relief, and it would have helped me to realize that what I'm experiencing is totally normal, because honestly, nursing school can be pretty shocking as far as what you've been used to. Even if you've been a straight A student throughout high school and now you're in, or even before you get in nursing school, even if you've been doing really well, going into nursing school is not the same. It's very different. It's honestly, to me, I would say it's almost like learning a different language, because there's so much wealth of information you need to understand, not just to mention the actual medical information, but also the culture of nursing school and the culture of nursing, and learning how healthcare is in itself. So here's the first thing that you can expect when you're going into nursing school. The first and number one is that the expectations will be high from the beginning and all throughout the program. All right. So I remember one of the things that I was really surprised by is the level of what they expect from you, like right from this point, from the very beginning, like as far as what they expect you to know, even if you haven't been pre-exposed to the information before, your commitment level, the time that you need to invest in not just attending the classes, but outside of the classes, the amount of reading you have to do, the frequency of the quizzes and the exams, and how bulky the information is, and how detailed the information is, and how sometimes you have a limited amount of time that you have to complete it in. Even when it comes to doing like care plans, like for example, when you're doing those care plans and you're having to, really go into depth about the detail of the care plans, some instructors have very high expectations around how well you do the care plan, right? Where you explain it, you say as evidenced by, you list the symptoms, you go into in depth about the interventions, the short-term goals, the long-term goals, all that wonderful stuff, right? And so it can be challenging at the beginning. And one thing I will tell you is just to expect it to be very high and kind of demanding. If you're going through a good program, expect that the expectations from you will be nothing short of anything small, right? It will be kind of demanding, and I would encourage you to clear out or remove as much responsibilities that are or could take away from your time in the program. It's not something that you can go in lightly, like, oh, I'm just going to do a couple hours a week. No, it's something where you really have to commit a lot of time to. So that's the first thing. Number two is that your class size will be large in the beginning. All right. So what that means is that the people essentially, honestly, say hello to your left, say hello to your right, and one of the people on your left or right, they're not going to be with you by the time that semester is over. So I would encourage you at the beginning, definitely meet people, connect. These could be your study buddies throughout your entire program, but also know that some of them may not stay. Many of them may not stay, honestly. So don't get too attached to people in your first semester, right? So like meet them, spend time to study, but don't get too attached, because some people, they may discover that the program is more than they can handle and will leave. And hopefully that won't be you, right? Hopefully you won't be that person. The third thing that you can expect is that the first day, and honestly, even throughout the semester, is going to feel pretty overwhelming. And it will, honestly, it typically gets more overwhelming after the second or third semester, depending on the type of program that you're going through. Okay, but the beginning will feel very overwhelming, especially if you're not used to, going to clinicals, right? Because that's something that's brand new. That's not something that you do in other types of majors. And they're also having lectures. Some lectures, when I was in nursing school, I don't know how maybe for the program you're going to go through, the lectures were at least 3 hours long. So it wasn't like you go to class for 45 minutes, an hour, and then leave. It was like 3 hours, so what you would do ahead of time is make sure that you eat well before you go to class, right? It would be kind of disruptive if you started chewing on snacks because you're so hungry during the lecture, and the sound of the food is making noise, or the instructor tells you to leave the classroom because you're eating in the class and they don't tolerate that, so like make sure that you use the bathroom. Like, you can get up and use the bathroom during the lecture, but I don't want to miss 1 minute of the class, right? Because everything that they tell you could be very important, and it can matter a lot for the entire program. So before you go to the class, make sure that you go to the bathroom and make sure that you're well fed, because sometimes many lectures that last for more than an hour or two, and so you have to be prepared to sit there for a while. Maybe even go to the gym if you have time to do that. Maybe go to the gym for like half an hour so that way you can move your legs, move your feet around, and then go to class. So now you're awake, you're alert, and your legs were already moving because you're getting ready to sit down for several hours. Okay? So that's one thing I would definitely tell you, is that the first day will feel overwhelming. You do need to get yourself a planner, okay? So you need to be organized, because, like I said, there's a lot of details behind your success. And so nursing school, it will wean out those who are not truly disciplined or can't learn to be disciplined for the sake of the program. So you need to get a planner and you need to organize yourself. And like I said, if there's other outside responsibilities that you can control and you can remove, do that, right? So maybe it is, any volunteer activities that you're part of, you need to cut it down or not do it for now. Or if it's, working, if there's another way you could pay for your education or cut down your hours. I know that's not ideal for everybody, but mostly, honestly, being able to focus and study is really important, because the program, they will kick you out if you don't succeed after the first semester. So there's a certain grade level that you will need to be expected to pass per exam or per test or per care plan. And if you don't do that, you can get kicked out of the program. So that's why I wouldn't say, start a new job and then start nursing school. Like, don't try to remove as much extra time, because if let's say you work a job 40 hours a week and you go to nursing school and you can't really focus and study very well, then what's the point? Because that's the reason why you got the job, right? So you want to remove those possibilities. The fourth thing, and this is honestly not easy to say, and it's like, it may sound contradictory, but the reality is that when it comes to all the staff, the clinical structures, everyone that you encounter in your nursing program, is that not everyone will be rooting for you. Okay? I know that probably sounds terrible, but not everybody will be rooting for your success, will be believing that you can do it, that will be believing that you can finish and you can go to the classes and, do well on the exams. Not everybody will be rooting for you. If you're one of those people where you need people to, pat you on the back, or you need the instructor to tell you you're doing a good job, then look somewhere else, because that's not what you're really going to get from nursing school. All right. Now, you may be fortunate. You may get a teacher that is so passionate about what they do. Come to my office hours. I'm here whenever you need me. That type of stuff. But 9 times out of 10, you're probably not going to experience that. And so not everybody is going to, oh, keep going. Oh, believe in yourself. No, you need to do all that on your own time. You need to pump yourself up when you're not in the class, right? When you're not attending clinicals. You need to encourage yourself, whether it's coming on YouTube and watching something motivational, or on a different social media platform and pumping yourself up, or writing affirmations, or leaning on your family and friends. But don't expect that the people, the staff, are all, I'm talking about every single one of them, going to be cheering you on until you finish. I know that firsthand. Not everybody was cheering me on. The instructors weren't like telling me, oh, keep going, Chioma. Oh, you got this, Chioma. No. So do not expect to be coddled, babied, encouraged, none of that stuff. This is the real game, right? One day you're going to finish, right? If you do, right, God willing, you're going to finish, and you're going to be responsible for real life people. So nobody is going to, tell you, keep going, you got this. No, not everybody's going to do that. So you have to do that for yourself. Number 5, the fifth thing, is that you'll be expected to make your schedule extremely flexible for nursing school. All right? There's not going to be, oh, let's work around your schedule type of thing. No, right? So you're going to be expected, meaning that, okay, this is when the office hours are. You either show up here or you don't. There's no, oh, I always work on Tuesdays. Can you meet me on Wednesdays? None of that. All right. This is when clinical days are going to be. This is the time that we're going to meet at, where you're going to have to be there at 7 a.m. You know what? I'm actually going to be coming off of my night job that finishes at 7:30. So can I be there at 8? No, nothing like that. You need to submit to the program schedule. You need to submit to the program's timeline. There's no like, oh, can you fit this around for me? No, this is the deadline. This is the hours. This is the time. Do it or don't do it or get kicked out. That's the reality. Okay? So that's why I said at the beginning, and that's what I said earlier, whatever outside responsibilities that you have, try to reduce them as much as possible before you get into the program, because people are not going to maneuver things to make it easy for you. They will happily, with no hesitation, right? You pay for the tuition and then you get kicked out of the program and you can't come back. It will not be an issue for them, right? So you need to be flexible with your schedule. And number 6, here's the last one. Your clinical site, right, may not stay the same throughout your semester, and definitely not the program. Okay? So it really is going to depend on what type of nursing program you're going through, because you may not have clinicals your first semester. Like, for example, I went through a BSN program, so it was more about theory and lecture the first semester. It wasn't clinicals the first semester, right? But once you get into that, though, the site that you're going to have clinicals at will not necessarily be the same. It could even change midway in the semester. Hopefully not, right? But it may not be the same, so don't get too comfortable at the site, all right? But get familiar with it. Once they say, okay, you're going to be at this hospital or this nursing home or this whatever, make sure you get the directions from where you live to the site. Learn it, know it, get comfortable with the driving there, and be ready to do it when the time comes. Okay? But usually, a lot of times, it's not going to be the same. It's going to rotate. It's going to be different. So just be mindful of that. Okay? So that's essentially the 6 different things that you can expect during your first semester of nursing school. Now, if this is something that you feel like you want even more help and more information, make sure that you go ahead and subscribe and follow this video, follow this channel for more information. And as well, you can go ahead and join my nursing academy. So inside of my nursing academy, there's where I provide you with pretty much everything you need to know from A to Z, all from the time that you are getting ready to start nursing school all the way until the time that you graduate and take your NCLEX exam. So inside of the academy, this is where I provide you more trainings, more information, so that way you can feel more confident in nursing school. I recommend, if you can, you watch at least one video a week inside of it, so that way you can get an idea what you need to know. And there's so many different topics, everything from what to expect in nursing school in more detail, all the way to passing certain types of exams, and then of course content. So me going over different types of medications, different types of diseases, and then how to prepare once you get closer to your graduation date. So if that's something that you want to learn more about, simply go click the link below this video for more information to be a part of my nursing academy. And I hope, once again, I hope that you found this helpful. If you did, make sure that you hit the like, share the video, and make sure that you tune in for the next time. And go ahead and click right here so that way you can watch the next video where I give you more insights in your journey. All right, thank you for tuning in, and I'll see you the next time.